Well, it's a new year and a new you, but for many suffering from degenerative disc or bulging discs, 2021 is going to look a lot like 2020 and maybe even worse because these problems don't go away. We're here with Dr. Miller at Total Health Chiropractic to talk about degenerative disc disease and bulging disc and how he can help you. Hi, Dr. Miller.
Good to see you, Todd.
Great to have you here, or thanks for having me here. I'm so used to you being in our studios, but here we are at your beautiful office and talk about what we do here and what degenerative disc disease is.
Well, a lot of people are struggling with neck or back pain. Unfortunately, when we encounter stresses in our lives, and that's physical stress, chemical stress, and emotional stresses, and we don't do healthy habits to maintain the health of our spine, usually that would be proper nutrition, spinal hygiene exercises, and regular chiropractic care, our discs in our spine, which are these pads and spacers between the vertebrae, can actually degenerate where they start to dry out and thin down. When that happens, these bones become closer and it can start pinching the nerves, or even worse, the disc can tear and they start bulging or herniating out where they actually push out into the nerves or spinal cord. That can be a very painful condition, limit a lot of mobility in the spine, and sometimes when it affects those nerves, not only can it cause neck or back pain, but it can affect the extremities in the arms or the legs, either causing numbness and tingling, sometimes it's shooting pain, or other times they notice quite a bit of weakness where they may feel like they may fall because their leg could go out, or they're not able to grip things throughout the day.
When people go through this, what are some of the typical treatments they use?
A lot of times they're recommended to do physical therapy. Sometimes that's even recommended before they know what the problem is. Other than that, it's commonly drugs, shots, or surgery. And the majority of the time, those treatments are not fixing the condition. They're not getting the back healthier. They're just there to mask the pain temporarily. And they all do have side effects. Some of them are as bad as death or even paralysis. But when the problem's not fixed, the condition persists. And a lot of times it gets so bad that, those options don't give them any relief either.
So if there was an option out there that was non-invasive and didn't have that, a risk of death associated with it, what should people be looking for?
Well, that's what we do in our office, Todd, and it's called DRX 9000 therapy. And this is a medical device that actually helps to heal and regenerate these discs. So there's no drugs involved, no shots, no surgery, there's no electricity going through your body. With the aid of computers, this machine's actually able to specifically stretch whatever area is a problem. With the aid of computers to, if the discs are bulging or herniated, it draws those back in off of the nerves, back into where it ought to be back here. Or if the discs are degenerated, it will draw moisture and nutrients into the discs where they can start to rehydrate and thicken up. And so with this process and the relief, our patients are able to get back to a normal life once again and not have to live so cautiously because, we're actually fixing the problem and getting their discs healthier.
It sounds like a fantastic machine that does fantastic things. How long typically does it take? Someone watching this right now says, oh, that sounds great for me. Am I going to be doing this for 6 months, or how long will that last?
Well, the programs are going to vary from patient to patient because everybody is different, so I custom tailor individual programs for that case. Over the years, I've done as little as a 2-week program, and the longest I've done has been about 4 months. But there's a start, there's a finish to this, and we plan that all out ahead of time and get those patients on board to get that fixed.
I think you said 2 words that a lot of people would like to hear if they're suffering, and that is finish line. I mean, there is an end to that pain if you can act now, really take the initiative in 2021 to solve this pain. And for that, you do have a fantastic offer.
Sure. So because it's the new year, for $20.21, we'll do a consultation where we'll meet one-on-one and talk about what's going on. And then we'll follow that up with a thorough physical examination of the spine so we can start determining what the cause of their pain is and make a decision if they're a candidate for DRX therapy as well.
Well, there's nothing more powerful than a testimonial, someone who's actually gone through this. And Herman, thanks so much for sharing your story with us. Talk about what drew you to Dr. Miller. What were you suffering from?
So back in August, I was building a deck at my house. And after 2 days of framing, I could not move. I had some pinched nerves back there, and I was not even able to stand on my feet and pull my pants on. I had to lean up against something, it hurt so bad. And something had to be done, so I had seen your segment before and went and visited Dr. Miller, took my wife along, and we both decided that this is the thing that I need to do.
Talk about that first visit. What was that like?
Well, the first visit, Dr. Miller was able to acquire an MRI I had recently, and that gave him a lot of information to go on, as well as an X-ray. And then he took it from there.
Now, Dr. Miller mentioned physical therapy, something that commonly gets prescribed for these types of problems. Is that something you did?
So I did not, but he strongly recommended, and part of his program includes exercises, which I'm not a fan of. But he strongly suggested that if I'm going to get better, it will include exercises, daily exercises. And then right now I'm going through the therapy portion with the exercise machine.
And then when it comes to the DRX 9000, you also went through that program?
Yes, I did.
And talk about that.
So it was 4 days a week. I came here and went through the DRX 9000 program, which they could control which vertebrae they're stretching, which section of the back. And it gave a lot of relief in terms of stretching and providing the necessary relief from that pinched nerve.
How long have you been going through this process? When did it start?
So I started before Thanksgiving. So
we're talking 2 months?
Yeah.
Ish. Mm-hmm. Okay. And before and after, what is life like now?
It's amazing. It's really comforting to know that there are solutions other than the invasive type, shots, surgery, whatever.
So you're able to do those things. Okay, so final question, how's the deck look?
The deck looks great.
Yeah. Hey, don't forget that special, $20.21. Act now. Don't forget, call the number on your screen and see what Total Health Chiropractic can do for you.